Fertility stimulation is a process of medications that help us recruit follicles to improve the number of eggs that will ovulate. Generally speaking, every month we ovulate one egg, but there is a pool of other potential eggs that are there in the ovaries that can get recruited with the fertility stimulation medications, and they involve injections for 10 to 12 days, as well as tablets sometimes for ovulation induction, as well as medication to protect you from ovulating before the egg retrieval, with the goal of getting a healthy pool of eggs, as well as quantity and quality. And that's the goal of fertility stimulation. The stimulation process begins the few months ahead with vitamins, lifestyle modifications, avoiding toxins, trying to get good night's sleep, lowering any exposures to unnecessary things and chemicals. And then during the process, it typically begins with you calling with your menstrual cycle. Some people don't get natural menstrual cycles or on birth control pills, then your coordinator will help with the timing of when the stimulation will start. And the protocol will depend on your baseline blood tests, as well as how many follicles we see on the ultrasound, to help guide us to get the best outcome for you. The stimulation process takes around 10 to 12 days of injections, such as follicle stimulating hormone or luteinizing hormone, as well as some medications that help you ovulate better, such as clomiphene citrate or letrozole or Femara. But during the stimulation protocol, it can vary. Some patients who have, for example, hypothalamic amenorrhea, and they rarely get their menstrual cycle, to initiate ovulation in some of those patients, it can take a longer window of time with a lower dose of medication to help recruit the follicles and try to avoid ovarian hyperstimulation syndrome. So every patient, the stimulation protocol is highly dependent on your age, as well as your baseline ovarian reserve tests, as well as if you have any underlying health conditions. In addition, it also depends on how you're responding to the specific protocol. So it depends on how things are going as well. But everything's very individualized to get the best quality eggs as well as quantity. Depending on which protocol you'll be taking, the IVF medications or egg freezing medications, the goal is usually to start when the follicles are all symmetric and when the levels of estrogen and progesterone are low, so that we can recruit the follicles. Some people start the stimulation in the luteal phase when the progesterone is high, and that is a protocol that's specifically chosen for your case. But generally speaking, you call with the first day of your period to come in on the second, third, or fourth day of your period to initiate the process and the protocol. Some protocols involve birth control pills, and when you're on the birth control pills, it tells your body not to choose the one egg for the month that was destined to ovulate, so that the pool of follicles can be encouraged to all ovulate together for the egg retrieval. And so each protocol is accommodated to your system, and which protocol will get us the best quality and quantity eggs.